So my name's Christine Hallett and I'm a Professor Emeritus of Nursing History at the University of Huddersfield. One of the areas I've done quite a lot of research on is the history of First World War nursing. And I got into that about 15 years ago because I was interested in the work that nurses were doing. I wanted to write a history of the practice of nursing rather than so much the profession or society of nursing. I wanted to write about their practice. And that got me into studying the late 19th and early 20th centuries. And I soon found that most of the writings by nurses themselves, a large chunk of writings, were by nurses who'd served in the First World War. It seems to be an area where nurses wanted to write about what they were doing and about their experiences. So there are more personal writings, things like letters and diaries and memoirs about the First World War than about any other aspect of nursing around that time. So that just got me into focus. I got really drawn in to that work, the nursing work of the women who were serving during the First World War. They were all women, by the way, the professional nurses at that time. And then that led me to write a number of different books. My first one was published in 2009, and that was Containing Trauma. And that's probably still what I really want to say about the work of nurses in wartime and in the First World War. The nurses who served during the First World War were a very complex, heterogeneous group from the professional point of view. They were essentially those who were regarded as and called themselves nurses at that time. They tended to be almost all white, middle class or upper class women. So in that sense, they were quite a homogeneous group. But in terms of their professionalism, there were three different groups. There were the trained nurses, and amongst them there were the trained military nurses. And they saw themselves and were seen by others as quite an elite within the whole group of those who nursed the wounded and sick during the war. The trained military nurses were either members of the Queen Alexandra's Imperial Military Nursing Service, often called QAs, or the Territorial Force Nursing Service. There were two different services, but they were all trained professional military nurses. And then there were two organisations that gave a minimal training, a very shortened training to volunteers. And they were the Red Cross and the Order of St. John of Jerusalem. And the Red Cross and the Order of St. John trained volunteer nurses who worked as auxiliaries to the trained nurses. And those volunteers came to be called VADs because they worked for VADs, Voluntary Aid Detachments, were units that took on nurses, ambulance drivers, people who would work in rest stations for soldiers. There was a whole range of VAD workers, but the ones who were remembered and really the quite iconic, I think, images of the First World War, the ones that are really remembered as VADs are the nurses, the volunteer nurses. So you had a number of different groups. And these, as I've mentioned, were all middle-class women, but there was a very significant group of men who really mustn't be forgotten, and they were the military orderlies. They were not really called nurses, but alongside the military professional nurses and the volunteer VAD nurses, you had men who were doing a lot of nursing work and a lot of nursing care, and they were employed by the army. They were actually part of the army, and they were serving with the army, with the Royal Army Medical Corps. But they tended to take orders from the nurses. It was a really complex setup because you had military nurses giving orders to volunteer nurses who often had a higher social status than them, so that could be complicated. There could be tensions there. And also giving orders to men who were not really part of their service, who were actually part of another service, the Royal Army Medical Corps. So I say there were tensions, but actually the reality was that for the most part, all of these groups worked really well together. The letters, the diaries, the memoirs that I've looked at really suggest to me that the idea that they did not get on and they did not work well together is a bit of a myth, that in fact the teamwork was good at that time during the First World War. On the front lines, on all of the wartime fronts, so on the Western Front in France and Flanders, in the Eastern Mediterranean, in Egypt, and on hospital ships in the Eastern Mediterranean, in Salonika, on all of the fronts where the Army Medical Services were working alongside the Queen Alexandra's Imperial Military Nursing Service. What you had was quite a complex series of lines of evacuation. So if you take the Western Front as the most typical front that we probably have most evidence for, what would happen is that the wounded would be picked up by stretcher bearers on the battlefield and taken to military aid posts, from which they would be put into motor ambulances and they would be driven to casualty clearing stations. So the idea was to get them to casualty clearing stations as quickly as possible. And those casualty clearing stations were the first place they would encounter nurses, military nurses. And a lot of the triage, a lot of the assessment of the patients was done by those nurses in the casualty clearing stations. And because the wounds were so bad, often, very serious shrapnel injuries, blast injuries, bullet wounds, because they were so severe and often contaminated and infected, the idea was to operate on those soldiers very quickly so that you could cut away any infected material before the infections took over. Things like gangrene, anaerobic, really severe wound infections. If you could cut all of that infected, contaminated material away and then start some wound irrigation with antiseptics, if you could do that within hours rather than within half a day or within a longer period of time, if you could do that quickly, you could save lives and you could save limbs, you could avoid amputations. So that's why they had a kind of full complement of medical and nursing staff very close to the front lines in those casualty clearing stations, and that included fully trained nurses. After that, the patients would be, once they'd had their surgery and recovered a little, they would be put onto ambulance trains and taken back to base hospitals. So there were a lot of base hospitals on the north coast of France in places like Étampes and Boulogne. And there you would have full teams of medics, full teams of nurses, and VADs. You would have VAD volunteer nurses there as well, that little bit further back from the front line. I say you had full teams of medics and nurses, but actually during rushes, like during the Battle of the Somme or the Battle of Passchendaele, they would find themselves very short-staffed in actual fact. But they worked as teams within those base hospitals. So from there, a patient would be put onto a hospital ship and brought to one of the ports on the south coast of England, and then another ambulance train and taken to a general hospital or an auxiliary hospital in somewhere in Britain. That could be anywhere. It could be as far north as the Northern Isles of Scotland. They would be distributed throughout the country via ambulance train. The lines of evacuation at the time were an incredibly well-oiled machine. They worked really well. They were a real credit to the medical and nursing staffs of the time. And there were a lot of doctors, yes, and professional nurses, and military orderlies working with the nurses. There were a lot of these different types of workers who were working very effectively together in all of these different scenarios as patients were taken further and further back from the front lines, getting treatment at every stop. In a casualty clearing station, when they were first established in the autumn of 1914, you might get just a couple of professional nurses there working alongside the doctors and the orderlies. But by 1917, there was really, these were quite big hospitals. If you take, as an example, a specialist abdominal centre at Brandhoek in Belgium, that by 1917, things had developed and evolved to such a pitch that in that one specialist centre, you had 32 trained professional nurses. So it was like a big stationary hospital by that time. And alongside them, there would be a large number of military orderlies and obviously fewer doctors. And the doctors would tend to be, they were mostly surgeons, and would tend to be occupied in the operating theatres most of the time. So it was the nurses who were assessing and doing all the care and giving the treatment to the patients. So this could involve a large number of nurses by about 1917. And that continued. I think the system just evolved gradually throughout the war. And the Queen Alexandra's Imperial Military Nursing Service was being constantly asked for more and more nurses. It was quite difficult for Maud McCarthy, the matron-in-chief in France and Flanders, to find the number of nurses that were required. What happened was that during big, large campaigns like the Somme or Passchendaele, or large pushes on the front line, they would have to bring nurses from the base hospitals forward to the casualty clearing stations, which would leave the base hospitals very short of trained nurses, which would then mean that the VADs, the volunteer nurses, had much more responsibility. By 1917, 1918, VADs were taking on the kind of responsibilities that in 1914, fully trained nurses, would have seen as the pitch of their work. By then, because of the shortages, VADs were doing a lot of that work, complex wound irrigation, wound dressings, that kind of thing, giving of medications. So things did evolve, but they also came under a lot of pressure, which means that meant that a lot of those professional nurses and VADs were under a lot of pressure during those years. In casualty clearing stations, nurses would be living and working in tents up until, under canvas, in canvas tents, up until about 1917 and into 1918, when those tented hospitals came under shell fire and were bombed from the air quite frequently. And then what happened was that they started to build huts. So they were then working in wooden huts. So it would be tents or huts. The huts offered them more protection, obviously, from shrapnel. But it was all, quite basic and primitive. You can read memoirs by nurses who were working in those casualty clearing stations close to the front lines about having to wear gumboots, having to wear Wellington boots, to literally wade through water between patients' beds within the tents. Obviously, that was only when the conditions were at their worst. But the weather could be extremely unforgiving in northern France and in Belgium during the winters, or almost at any time of the year. The Battle of Passchendaele was probably the campaign that saw the worst conditions because the rain was just relentless on the front lines during that battle. And we all know, it's gone down in the history and mythology of the First World War, that soldiers were ploughing through mud on the battlefields. And the conditions were appalling. The same was true in the hospitals. So the nurses were wading through mud to get to their patients. And then as the winter set in, kind of later on in the year, the ground froze, and there are stories of nurses having to kind of hold thermometers in their pockets between their hands, so that the thermometers wouldn't freeze, having to break the ice on the top of their wash bowls in the morning when they got up in the morning in their tents or in their huts, having to break the ice in order to wash their hands and faces before they went on duty. I think it was a very well-controlled environment, but the conditions could be very basic. On hospital trains, I think it was probably warmer, but it was cramped. The conditions were very cramped. You see photographs of nurses' bunks, their compartments where they slept on hospital trains, and they look, the photographs make them look a little bit romantic, with little tables and bouquets of flowers and vases of flowers on the tables. But I think living in a tiny bunk, it's a bit like being on a sleeper train overnight, on a tiny bunk, and that's where you live and sleep, and you eat in a tiny canteen area with the other workers on that train. I think that could be quite trying. They could get short of water as well, which could be very trying for a nurse, working with patients, trying to keep the patients clean. Patients who might come onto the trains with the mud of the battlefield all over them and all over their uniforms. So they were having to improvise and having to work with what they had. Quite a few of the nurses' diaries, of the nurses who worked on hospital trains, on ambulance trains, they talk about having to move between carriages by climbing across the gap or jumping across the gap between different railway carriages. And they called this footboarding. You would come out of one carriage and you would have to actually cross a gap that could be a couple of feet wide to get to the next carriage. And this kind of slightly acrobatic performance would take place in long skirts. They actually did shorten the skirts by a few inches halfway through the war because they realised that these long skirts for nurses were a bit impractical generally anyway. But what happened was they'd be assisted by orderlies, by their colleagues, the orderlies, who would kind of help them across the gap. But I think some of them, a lot of these nurses, they were quite adventurous, and I think they took quite a lot of pleasure and pride in the adventure of having to perform these kinds of manoeuvres. It was a bit dangerous though, and it was against the rules. They were told they mustn't do it, but if you were the nurse, one of just a couple of nurses, the fully trained nurses on a hospital train, you had to move between carriages because you were the person responsible for assessing all the patients. Within a carriage, there would be at least a couple of orderlies caring for the patients, but you were the one who had to go between the carriages to give the medications and to check all the wounds and set up all the wound irrigation equipment. So actually they had to do this. It's kind of typical of the sort of dilemmas they were posed with. Like, you must not footboard, you must not jump between carriages, but actually they couldn't do their jobs if they didn't move between carriages. So they had to make judgments about that. And the ones who wrote about it said, of course they did it. I think Florence Nightingale she was an inspiration to the First World War nurses. She was their icon. In their letters and diaries and memoirs, they often mention her. They see her as having really started the tradition that they were now participating in. And there's a lot of truth in that. In some ways, there's a bit of mythology to that because she was such an iconic figure. But in many ways, she was the person who really made it possible for nurses to work close to the battlefields, close to the front lines in military hospitals. She was the first woman who saw herself as a professional nurse and claimed that professional identity to actually go and work within a military hospital, sanctioned, of course, by the government of the day. She was able to do that because there had been, obviously, we're aware there'd been a scandal that the care was seen as inadequate in those military hospitals at the time, and the government had decided they must do something about it. Russian nurses and French nurses were already there. So the government allowed Florence Nightingale, in fact invited Florence Nightingale to take a group of 38 nurses to work at first in the hospital at Scutari, in the military hospital there, but then it's a range of military hospitals, across that area, that part of Turkey, and on the Crimean Peninsula itself. So she was the first to actually be allowed to actually do that work and to do it well and to be seen as having performed that difficult work within what had previously been a male bastion of military medical treatment and care. She kind of gained that foothold for female nurses, but it was only a foothold, it was really a toehold right up until the Second Anglo-Boer War. There were really only a dozen or so military nurses, fully recognised military nurses in Netley Hospital and in the Royal Herbert Hospital in Woolwich, right up until the Second Anglo-Boer War, when again there was a similar scandal where the nursing care was seen to be inadequate, and there was a kind of rush to try and bring female nurses, fully recognised military nurses, but also volunteer trained nurses and volunteer nurses who were not very well trained. A number of different types of nurse went to serve in the Second Anglo-Boer War. And before the end of that war, it was recognised that you really couldn't just improvise every time there was a war and just invite women, whether trained or not, to go to the front lines. That really a fully recognised military nursing service had to be formed. So in 1902, the Queen Alexandra's Imperial Military Nursing Service was inaugurated. So it was a really slow progress from Florence Nightingale's work in 1855-56 through to the Second Anglo-Boer War at the turn of the century, and then the establishment of the QAs. So I think they did recognise that Florence Nightingale was not only their heroine and their icon, she was the one they'd read about, and they'd read her book, Notes on Nursing, and that was the fundamental text for nurses at the time. So not only was she that kind of inspiring icon for the nurses, but she actually had formed the foundation for the creation of their service. Probably one of the most striking examples of something we learned because of the treatment that evolved during the First World War is the treatment of wound shock. So the idea of the golden hour, the idea that if somebody has been wounded and hemorrhaged or has been involved in any kind of accident that causes shock, perhaps because of hemorrhage or just because of trauma, what you really need to do is treat that trauma very quickly. The idea of the golden hour is that you have to provide some very intricate treatment within the first hour of wounding, and then you've got a much better chance of saving that patient. And they learned that really by recognising that the wound shock that patients contracted on the battlefield could be treated more effectively if it was treated quickly in regimental aid posts, but also in casualty clearing stations. They could get patients back to casualty clearing stations. In some scenarios, it took hours and hours, but in some scenarios they could do that quite quickly. And they would then pump fluids into patients, not using intravenous techniques like we do now, but subcutaneously with needles inserted just under the skin in various parts of the body to replace fluid, so that the system could start to recover quickly from the physiological shock that was caused by the wound. Actually resting patients, warming them up, because they were often hypothermic after a wounding on the battlefield. So warming them, giving them fluids, resting them, and then starting to treat them as quickly as possible. saved a lot of lives, and that was recognised. Now, I think our ambulance services now, that's one of their first, that's one of the first things they learn is the golden hour, the idea that you treat immediately on the scene and you treat in the ambulance, and then you treat again when the patient gets back to hospital. You don't kind of wait and just carry people back to wherever the treatment scenario is. I think we learned a lot about asepsis and antisepsis as well during the First World War. It was a pre-antibiotic era. We had no antibiotics. We didn't even have sulfonamides, which were the drugs that preceded the antibiotics. So there was no medical line of defense against wound infections. And so nurses and doctors, and it was often the nurses who did this work, they learned to treat the wounds with antiseptics, with chemical compounds such as sodium hypochlorite that would actually kill the bacteria in those wounds. But they also learned how important it was to use an aseptic technique, that every instrument you used, every dressing you used, and your own hands had to be free of bacteria, had to be free of, they didn't really understand the concept of viruses at the time, but they understood that they had to completely free all of the areas where they worked, all of the equipment they used, and themselves, their own hands, from bacterial infection. So that was a really important learning of the First World War. And another area that we really began to learn a lot about during the First World War was in mental health care, in the treatment of trauma. What we now call PTSD, post-traumatic stress disorder, was at the time referred to as shell shock. And it was something that took everyone by surprise. They didn't know what they were facing in the first years of the war, but they learned very quickly, how to offer a kind of containment and reassurance and rest and care to soldiers in casualty clearing stations and base hospitals. And I think post-war, a lot of the psychoanalytic treatments that had already begun but then evolved further, they really accelerated in the post-war period as a result of what had been learned during that campaign, during that war.